Hello, welcome to today's Odyssey. Today we'll be talking about a certain sneaky little threat that's been spreading onto the shores of multiple local beaches. Even the CDC doesn't have adequate resources to test all beaches. This threat is so tiny that one cannot spot it by inspecting the water using their eyes alone. The intruder makes a move, entering through a weak spot on the protective layer of the victim, past their skin to infiltrate the body. Meanwhile, the victim is unwinding to enjoy their evening as they submerge themselves in the nice warm waves, calmly brushing onto the shore, fully unaware of what's happening. We all know that if you have a fresh cut, it'll attract those bloodthirsty sharks, as they're able to sense the blood trails from several miles away. But the terrifying thing is, those fresh cuts will also allow another predator to strike. Not only do we have to fear extra curious sharks, we also have to wage war against an enemy that's evolved specifically to infect its host within 12 to 72 hours once it's entered the body. There's a chance that having this type of bacteria inside your body could lead to fatal or deadly results. To get straight to the point, the suspect we're talking about is known as Vibrio bacteria. Horrifyingly, there's more than 100 species of this bacteria, but more specifically, we're talking about Vibrio vulnificus. This peculiar bacteria has been identified as a source of disease since 1976, so it's been with us for quite a long time already. You could say this is a form of flesh-eating bacteria that lives in warm salt water, as they can cause infections that destroy your skin and tissues. Isn't that just great? That's exactly what I need when I want to enjoy dipping myself in the nice warm wave currents. The results are pretty detrimental, however. This only occurs in rare situations. But that's when the situation gets serious, where you end up having to remove the dead tissues by surgery or even perform amputations. From wanting to go to the beach to paying the hospital a visit. All of this can happen just because you didn't take the necessary steps to ensure your safety. We want to avoid this at all costs. So throughout this video, I'm going to cover all the ways you can prevent this from happening to you or your loved ones. Stay tuned. So, how exactly does Vibrio vulnificus get around? Well, as we've mentioned earlier, the bacteria lives in warm salt water. But why? Let me put it this way. The temperature affects how they thrive. Warm water helps them grow and populate faster when the temperature exceeds 59 degrees Fahrenheit, which is why they prefer warm over cold. And this bacteria has been rapidly spreading north thanks to global warming, as the Earth is slowly incubating itself to give the bacteria a better chance at spreading. You can tell that this bacteria loves warm weather. So what happens in the summertime is that bacteria like this tend to overgrow, and if you have an open wound, including from a recent surgery, piercing, or tattoo, you should never be getting into the water because there are any number of bacteria that are in that water, and you'd be giving the bacteria an easy entrance. Technically, you could cover your wounds with waterproof bandages, but the chances of that protecting you isn't guaranteed. Now let me tell you how they're actually taking tours and ending up on multiple shores. A study conducted by researchers from Florida Atlantic University found out that Vibrio bacteria is adapting and sticking to a seaweed called Sargassum. It's that brown seaweed that likes to cruise around in the ocean as huge islands, constantly surfing and expanding while getting swept up onto shore and emitting a gas that can smell like rotten eggs. And guess what? Vibrio bacteria have also been adapting to plastic marine debris. We humans don't seem to stop polluting the ocean, so debris is becoming another great source for carrying Vibrio bacteria straight to the lovely beach you're staying at. Ever since 2011, there's been a huge belt of Sargassum expanding. It was around 5,000 miles long, circulating annually between the Gulf of Mexico and the Mid-Atlantic. But this seaweed belt has long disappeared now after being around for decades. That's somewhat a relief. But now it's spread to Florida, and it's pretty popular in some beaches such as Miami, Cinnamon Beach, and more. Now, if you do hit the beach, be cautious and look for these signs to prevent yourself from ever catching Vibrio. If the water looks murky or off color, it might be polluted, so please don't risk entering it. Vibrio bacteria does not smell, so you wouldn't be able to indicate them with a certain special smell. Although they usually appear on rotting Sargassum seaweed, turning your beach experience into a breeze of rotten eggs. You have a very good reason to just avoid the rotting seaweed because the rotten egg smell can give you respiratory problems if you breathe in all of that hydrogen sulfide, and on top of that, the seaweed also contains arsenic in its flesh, making it extremely dangerous. Seaweed is known for being good for you, but trust me when I say it's not a good idea to ingest sargassum or use it for fertilizer. So, you don't only find this skin-shredding bacteria in warm coastal waters, they can even survive freshwater depending on the conditions. But Vibrio bacteria usually prefer freshwater and saltwater mixed together. In fact, they need salt for their growth and survival. Once you enter the water, you need to look for these signs. If you begin experiencing itchiness or burning, or see a rash form on your skin, jump out of that water immediately and wash it with fresh water and soap, then go see a doc. Don't take chances with open wounds. If you do get infected, the bacteria could possibly reach the bloodstream and spread throughout the entire body, causing septicemia. That's an extremely fatal outcome, but the chances of this happening aren't guaranteed. If you're very old or very young, if you have a weak immune system or have severe injuries, then the risk of it occurring will increase. Well, it's true, we now have better treatment than we did back then in 1976, but 10 people have still died from the infection this year out of 43 cases reported in Florida. Vibrio bacteria, including Vibrio vulnificus, cause an estimated 80,000 illnesses and 100 deaths every year, according to the CDC. Now, we know that we can't go around on the beach carelessly, but here's something else we should be wary of. We should be wary of consuming seafood, because about 52,000 of these illnesses are caused by this alone. By mentioning this, I'm not telling you that you shouldn't ever eat seafood again. It's only a problem if you eat raw or undercooked seafood, because it can be a breeding ground for Vibrio. Usually, it's found in contaminated shellfish, more specifically if they were found in warm ocean water. To kill the bacteria, make sure you cook your food at 145 degrees Fahrenheit or higher, and keep things clean to avoid any cross-contamination. If you do get infected, listen up. We've already covered the worst-case scenarios earlier, but this is what you'd end up experiencing most of the time. Something like diarrhea, nausea, vomiting, stomach pain, fever, chills, and skin ulcers. Some folks get over the infection after a few days if it's a mild case, but it also depends on your overall health. If your immune system is weakened, or if you experience underlying medical conditions, you're not so lucky. But if you catch your symptoms early, you can take medications to treat it. Antibiotics such as doxycycline is generally recommended, or a fluoroquinolone can also be effective. As for children who have caught the infection, trimethoprim and sulfamethoxazole are recommended. But please note that I'm not a professional when it comes to medical advice. The amount should be prescribed by a doctor because it really does depend on the person and how long they've been exposed to the infection. This video is simply made to equip you with the knowledge to avoid getting infected with Vibrio. As for the rest, let your doctor take care of it. And there's no messing around here. Let them know if you've been in the ocean or eaten raw seafood recently. The sooner you get treatment, the better your chances. Don't wait around on this one. The timing really matters here. Woo! That was the news flash for today. I appreciate you all sharing this odyssey with me, and make sure to inform those around you or send this video to your friends because this is a warning. If you want to learn more, check out the description for additional links, and don't forget to subscribe. Subscribing is a form of bookmarking the channel to see more of our awesome content. With that, I'll see you next time.